This segment is sponsored by Metropolitan Pediatrics.
April is Autism Awareness Month, and to give us a better understanding of the disorder, we're here at Metro Pediatrics in the Gresham location with Dr. Ryan Lloyd. Dr. Ryan, let's start with the ABCs of it. What is autism spectrum disorder?
Good question. Autism spectrum disorder is a set of neurodevelopmental disorders. That means it's a brain disorder that affects how a child develops.
At what age in a child's life should you start looking for signs, and what are the signs?
Yeah, so we know that we can reasonably diagnose kids as young as 2 years old, all the way up through adulthood. At Metropolitan Pediatrics, our pediatricians screen kids early and often. So not only do you have access to your pediatrician, but you have an expert in a pediatric psychologist that can consult, do brief observations, or here at Gresham, I actually do comprehensive autism evaluations as well.
And what does that include?
Yeah, so full evaluations for autism will look at how their cognitive functioning is, their development in areas such as speech and communication, nonverbal communication, areas such as social skills, things like repetitive behaviors, using imagination in play. There's a broad range of things that we evaluate and assess for before we make a diagnosis of autism.
So let's say a child comes to you and you do diagnose them with autism. What do you do with them going forward?
Good question. So at Metropolitan Pediatrics, the evaluation doesn't stop with the diagnosis. We're a medical home, so what that means is you have full access to a full team of professionals to help you, and we really imagine ourselves as partnering with families to help you connect with resources. And so we have pediatric psychologists, medical social workers, nurse care managers, referral coordinators that work together with your insurance. And we check in with you and your family often to make sure that you never feel alone in trying to handle such a big diagnosis like autism. The diagnosis of autism doesn't change who they are. And so what we really want to aim at is building them up and giving those supports and scaffolding that child so that they can reach their highest potential. And we won't know what that is until we give them those supports and we give them the opportunity to grow and develop.
Well, Dr. Ryan, thank you so much. You've definitely helped my understanding of autism for Autism Awareness Month. And if you have any questions, come see Dr. Ryan at Metropolitan Pediatrics in Gresham. Thank you so much.
For more information on Metropolitan Pediatrics, visit them on the web at metropediatrics.com.